Hi there, this is Nicole Lee with Health Beauty and More. And I have something interesting to read to you about contact lenses that change their color according to the wearer's blood sugar levels, which is a breakthrough for diabetes patients because they don't have to prick their fingers like they do to monitor their blood glucose levels if they are wearing these special contact lenses. I think that's an awesome idea, and it's not available right now, but they are definitely working on getting it to the consumer in the near future. I don't know how expensive they would be, but probably would be quite expensive. There's supposedly two types. One's called boronic acid based lenses, and the other type is the photonic crystal based lenses. They both work differently. The boronic acid contact lenses, it says uniquely capable of binding with sugar molecules to help measure the glucose levels in the fluid of the eyes. The fluid coming from the tear ducts contain glucose molecules, which in the boronic acid they bind with the molecules of sugar in that fluid. The result is a fluorescence, but will glow when light from a special handheld blue light is shown on the eyes. The intensity of glow lets the wearer measure their blood glucose level. The brighter the fluorescence, the higher the glucose. The second one, the photonic crystal contacts, this detects the changes in glucose as well. Any swings in the blood glucose levels are reflected by a change in color in the contacts. So photonic crystals are made of a combination of boronic acid and other chemicals. The chemicals form a polymer chain, and they have receptors that bind to the structure of glucose. When they come in contact with glucose via the fluid in the eye, then the spacing and volume are affected, changing how light passes through the material of the contacts. And when the glucose is high and the level of glucose is also high, it'll show up in your tears. And it'll be more concentrated in your tears. And this actually produces a purple color. So if you see somebody walking around with purple eyes, you better tell them, did you know your blood glucose is very high? When it's low, the lenses will reflect a reddish color. That wouldn't look very good, would it? Normal glucose is supposed to produce a green color. These changes in color they're on the bottom edge of the lens. Okay, I see. So they don't actually affect the whole color of the entire eye. You would have to look into a mirror to look closely at the lens to see what color is reflected and to read your glucose level. The tears from your tear ducts do not reflect glucose levels quickly. It takes about 30 minutes for the glucose levels in the tears to reach the level in the blood. For most people who do these pricks every 3 to 4 hours, this should not be a problem because the numbers will be close to equal by the time they'd be preparing to do this test again. Interesting information, I thought, and for all those who have diabetes, that might be a candidate for that. When it becomes available, you check with your doctor and see if you're a good candidate for these lenses, and keep up on when they're going to be out on the market. He or she, your doctor, will probably be the first one to know before you do. This is Nicole Lee with Health Beauty and More. Thanks for listening, and be sure to subscribe, like, and share.